making sure to look at that. But I was pretty confused in which one give to the patient.
Yeah, so for the phosphate binders, we're almost always going to choose a non-calcium one. So sevelamer is the one that is in my mind. Some of them can only be used in patients who have hemodialysis. So you're like on this case, you're going to have to choose between, well, and maybe on the exam too. But so if a patient has normal high calcium or almost high or high calcium, we're not going to want to choose something that a phosphate binder that has high calcium. All right. If they have normal calcium, then we can choose or low calcium, then we can choose a phosphate binder that has calcium in it. And so then there could be two correct answers if their calcium was low. But if their calcium is almost high, upper limit of normal, or high, then we can't choose one that has calcium in it. Does that help, Victoria, or?
It's help, but I'm just like, I don't know why I'm like focusing in the considerations that says nausea, vomiting, and diarrhea. And for example, let's suppose that the patient is experiencing that. I should give the first line or not?
So those are side effects. Nausea, vomiting, diarrhea are side effects, I think, that you're referring to for that drug. Yep. Yes, those are side effects that are listed.
Yes, I'm sorry.
Sorry. The coughing is throwing me off here. So those are potential side effects, but if at the point that you got to that question in the case, the patient had recovered from their hospital stay. That it was 3 months later. So, and some of their symptoms might have been related to what was going wrong with them with their lab work. And so if you fix them with a medicine, some of those symptoms might go away, despite those medicines causing side effects. But you know, almost every single medicine, not you, Victoria, I'm not like picking on you, you all as a class know that almost every medicine has a side effect of nausea, vomiting, upset stomach. But when you take every single medicine, do you get nausea, vomiting, upset stomach with every single medicine that you take? No, it's just the most common side effect.
Okay, thank you.
Yep. Yes, the password is going to stay the same. Let me go back here. The password is going to stay the same. I will, first thing Monday morning, I will post the grades so that you know where you stand. So again, 9 o'clock on Monday morning. For the exam on Tuesday, you do not have to memorize normal values. I will tell you if it's high or low. That is not a good use of your brain power right now. So lab values, I will tell you if they're high or low on the exam. I have a question about loading doses. So when do patients need loading doses in CKD or AKI? They need loading doses when they're fluid overloaded. So they have peripheral edema, they have shortness of breath, and they're fluid overloaded. So they would need a loading dose of a hydrophilic drug because there's so much water in the tissue that that hydrophilic drug is going to leave the vasculature and go into the tissue and not be effective. So if they're fluid overloaded, they need a loading dose of hydrophilic drugs. If they have low protein in their blood, so they have hypoalbuminemia, low protein in their blood, they're going to need a loading dose of highly protein bound drugs because those highly protein bound drugs are going to leave the vasculature and go to the tissue where the protein is, because there's no protein in the vasculature. So we'll need a loading dose to increase the drug in the vasculature. If it has a long half-life, it needs a loading dose to get to steady state faster. Those are the 3 times that we need loading doses. Okay. All right. I am going to go through and private message you your scores.
Dr. Hall,
Yes.
can you send the password again because I forgot it?
Yeah, I'll put that in the chat. You can write that down.
Okay, thank you.
I'm sorry for the inefficiency with this. I was not expecting to do this, so please forgive me. I value your time, and I don't mean to have you all sitting around waiting on this.
Uh, can we leave if we receive the grade?
Yes, if you receive the grade and you don't have any questions, you can go ahead and leave.
Thank you.
I hope you all have a great weekend before you take off. If you have any questions, please feel free to reach out.
I have a question.
Okay, let me just get through this and then I'll go back to answering questions.
I put it in the message already. You can see it.
Okay. I'll get to that as soon as I get done with this.
In Jesus Christ's name. We'll make it in Jesus Christ's name. We'll make it in Jesus Christ's name.
everybody should have received their score in the chat. So now I'm going to go back to the questions. So you can practice the other case if you want. You can practice all three of them if you want. I'm not going to stop you from doing that. Please just let me know which one you want scored as your second try. Okay. Did everybody get a score? Did I miss somebody? There's a lot of chat. Okay. Just making sure. Okay. The quizzes will have the same password that I put in and I can put it in again. You cannot choose the same case. You have to pick a different case. If you are concerned about whether you need to take the quiz or not, again, for your grade, that is something you can calculate on your own with the scores that you have on Bright or on Canvas. So if that's something you're waiting to ask, then that's something you can calculate and do on your own and figure out what you like. If you don't retake it, what you have to do to on the exam too, to do that. I think those are all the everything else seems like private. Want me to talk about their things specifically. If there's any questions that people want to ask, I had a question about the AKI based on the urine output. And so you have to do the calculation based on what Dr. Song taught you. You have to look at the to see if that part is correct. But you need to be careful because each of the cases had a different time frame. So it was X amount of milliliters per X amount of hours. It wasn't 24 hours. So you have to do the math for that to figure out whether that was part of the excuse me, I'm sorry, whether that was part of the issue. I am not going to post a key because everybody is going to be taking a different case. And this is an opportunity for you to do better. So I'm approaching this opportunity as if it's the first try. So I'm not going to go over each thing. I'm not going to give you the correct answer. We can go over concepts, but I'm not going to give you the correct answer. I'm only going to discuss concepts with you. Because if I give keys, then everybody, and if I say what the correct answer is, then all this, that can get around. Not that it will, because you all respect me enough to not do that, but that doesn't maintain the integrity of the assignment. Yes, you will get the highest score. So there's no harm in taking it. It's not going to hurt you. You will get the highest score. It can only help you to take it again.
Yes. I'm sorry. You say that you use the highly protein drug when the albumin levels are high, right?
When the albumin levels are low in the blood, is that what you're talking about?
No.
You need to use a loading dose for a highly protein bound drug.
Okay.
Yep.
Dr. Hall, I have a question.
Yes.
So based on the AKI parameters for like so the one that says 1.25 over baseline,
Yep.
would that be like do we need like the baseline level for that?
Yeah, so the baseline level was in the case, which was in each of the cases.
Okay.
It said CKD and then it said baseline serum creatinine.
Okay. Right. Thank you.
Mm-hmm. You will be able to review the answers on Monday after everybody's turned them in. What other questions for the group? What other things do you need? We can actually go over the answers in class or at the exam review on Monday for all the cases too. I was asked to double check somebody's, so let me just. And they left. All right. Okay. I'm not going to post the correct answers on Monday. After the exam review on Monday, I will go through the answers, but I am not posting the answers. Because these cases, to make sure that there's not anything funky, take a lot of time and effort. Like, I did not finish these until 4 o'clock this morning, and I don't want you to all feel sorry for me or anything, but like, that's how much effort I put into trying to make sure all three were the same and hit the marks on the NAPLEX concepts. That I pulled all the questions from our NAPLEX practice exams and tried to hit the concepts that they hit in case-based there, combined it with my notes. And so because I've been so like because the chronic kidney guidelines were updated this year, I had to update all my lectures this year for this section, and I've been sick for the last 2 weeks. So much like you all, I have a lot going on, and I don't want to go through this again when I teach this next year of recreating the cases. I want to be able to fine tune the cases and make minor changes. So I will not be posting the keys for my own self-care and sanity. So.
Dr. Hall, I have a question.
Yeah.
Oh, and thank you for just helping us out with the case. The Finneron question. I have a question about Finneron.
Mm-hmm.
So do you have to like? It's like for using Finneron, do you have to have like, you know, in the PowerPoint, there is different like bullet points for using it. Do you have to like use are those like inclusion criteria that you need to have for using Finneron?
Let me pull up so we're all on the same page here. So these are when you would consider using it. They're not the only things that are like really necessary is that they have to have diabetes and CKD. And so that you can't just use it in CKD. They have to have diabetes and CKD. Outside of that, you're not going to want to use it if their GFR is less than 25 because it's contraindicated. You don't want to use it if they have high potassium because phenterone works just like spironolactone. It's a aldosterone antagonist. It's going to increase the potassium. So you're not going to want to use it if they have hyperkalemia. You want to make sure that you're maximizing the ACE or ARB first because that is the drug. Those are the drugs we have the most data with. You want to consider an SGLT2 before that because we have more data with the SGLT2 inhibitors than the phenterone. But these are not absolutes. The only things that are absolutes are type 2 diabetes, CKD, and this.
Thank you, Dr. Hall.
Yep. What other questions for the group do we have? If you're staying on for individual questions, I can make a breakout room and pull you in one by one. If you don't want to ask the questions in front of the group. So I can definitely do that if we're done with questions for the group.
I think you just answered.